My name is Dr. Andrew Dutcher, and I'm a member of the Neqotkuk Frist Nation. And I'm a psychiatrist out in Calgary, Alberta, and I'm training to be a child and adolescent psychiatrist, or a mental health doctor. So it came to my attention recently that Tobic recently got its first case of COVID-19. And this has a lot of people worried, scared, and understandably so. COVID-19 is a viral infection. It can be very serious on people's health depending on certain factors, and those that are more at risk include those like with chronic medical conditions or our elders. It can be spread from person to person through droplets, so if someone comes and coughs and sneezes on you or close by, that could be one way, or if you have close contact with another person, that's another way. Another way is if you're touching a surface that was recently touched by someone who is infected, and then touching your mouth, your nose, your face, that can also get you infected as well. So that kind of means, no more big auntie hugs, no more tongue kissing, and if someone tries to cover up a cough or a sneeze with a fart, I'd probably stay away from that person. Some things that you can do right now to keep yourself safe and the people around you safe include things like socially distancing and staying 2 meters away from people when you're inside and trying to stay safe. That would also include things like wearing a mask, as they've been shown to be effective in reducing the transmission of COVID-19. You also want to be washing your hands both thoroughly and frequently, either with soap and water or with alcohol-based hand sanitizer. From a mental health standpoint, because that's also a big part where fear and anxiety has really gone up when infections start to go up, and this causes even more problems in the home and for people to really struggle with day-to-day life as well. So we got to talk about that as well, where some things that you can do to help maintain your mental health and decrease that fear or anxiety is staying informed, checking in with the band and council, and listening in for Chief Ross's updates about what's going on in the community. But there's also lots of other sources that are reliable, and I'd recommend sticking with reliable sources so that you're not getting misinformation out there. And that could include things like the World Health Organization, or things like Government of New Brunswick, or Horizon NB websites to see what's the most up-to-date information. Some other important things for mental health include things like getting enough sleep, 7 to 9 hours for adults, a little bit more for young people, making sure you have a good diet, and eating lots of green vegetables if you can. If you've got an extra bag of fiddleheads in the freezer, pull them out, cook them up, or if you don't want to, you could send them out to me. It's been a long time since I've had some, so. Another thing would be getting daily exercise. So either going outside, going for a walk, or if you want to let a rabid dog chase you down the road, that's also another option as well. With regards to the last piece, you want to avoid as much as you can drinking alcohol and using drugs. Not only can these things affect your sleep and decrease your immunity to fight off infections, they can also cause other issues in the home with your family, and especially since most people are being stuck inside with their family now, we want to decrease as much as we can those risks. So we're going to need to do everything that we can as individuals to help take care of ourselves and make sure that we're healthy so that we can take care of our community and our elders. And so it's going to be on each individual person to make that collective move forward and be healthy as a community. So I recommend you guys stay strong, stay safe. I hope that you can take care of yourselves. Bye.